sadly, so we're gonna have to just hold on quickly. Just hold. Google. Okay. Yeah, we had some technical issues, so we're just gonna wait. Ready?
Good afternoon and welcome to the Link Show. Thank you very much for joining us today. My name is Dougal and alongside me here on the Link Show this afternoon is Rhoda.
Hi, welcome to the Link Show, everybody, and I'm hoping you're going to enjoy the show because, I'm looking forward to the conversation we're going to have, Dougal.
Yeah, certainly exciting conversation, and as you know, with the Link Show, of course, we unpack and look at everything Northlink College. So this will definitely be your tertiary institution of choice, and that is really what it is about in a nutshell, Rhoda.
That is right. And you know what? I'm so impressed because of the fact that Northlink always gives us all the critical information, all information you need as a parent, as a student, exactly why you need to go to Northlink.
Yeah, that certainly is the case. And we would like to remind you that this is an interactive show. So, of course, we look forward to your comments and questions on YouTube and Facebook as you are watching us. And thank you so much for joining us on the Link Show. And we've had some exciting episodes as well with the Link Show where we've looked at various courses and all of that. And today on the Link Show, Rhoda, health is definitely the underlining bit of conversation, isn't it?
Definitely. And you know what is exactly, you need to know for a fact as a parent as well that once you go to Northlink, all the procedures are in place, your child's safety is at stake, all of these concerns is definitely a parent's concern as well once you send them through to these institutions as well.
Yeah, and I like what you've said because that is definitely one of the boxes that when we make decisions, we look at.
Oh, yes.
You definitely have to tick that box. And that is what this discussion is all about. This is what today's episode of the Link Show is all about. So we're definitely going to aim and try and tick those boxes for you so it will lay all concerns to bed, as it would were. But please get in touch with us as well. We look forward to your questions and comments. So just to put you in perspective, we're going to talk to the occupational health officer as well from Northlink. We're also going to be talking to the professional nurse there as well. And then also the provincial health coordinator. So it is really, really going to be intense. And let's start things off today on the Link Show when it comes to occupational health and safety. Now, I'm going to venture a guess into what it is. Would you like to venture a guess? Let me put you on the spot there quickly, Rhoda.
Wow, dude.
Any idea?
First thing that comes up to me is health and safety.
Yeah. and am I right?
That sums it up for me.
Yeah. And we're making things up, me and you, but it is sort of those rules and policies and that is in place to keep people safe.
That is so true.
At the place of work, and in this case, the students as well.
Yeah, that's right. And obviously for this, you need somebody that's actually running this, which is the officer.
Yeah. And let me ask you this, before we actually speak to her, do you think these kind of rules are also, they evolve, isn't it? So they keep with the times?
I would think so, especially, with COVID and that. I can just imagine how that would basically kick in for somebody who's running being the officer to control that.
Yeah. Well, let's get the Northlink Link Show underway, of course, and find out all about everything that is happening at Northlink. So, Occupational Health and Safety Officer is our first guest today. Zandile Nombande is joining us. Zandile, good afternoon. Thank you very much for being on the Link Show. How are you doing, Zandile?
How are you guys?
Absolutely sweltering lekker. Terribly well, I must say. Terribly well, I must say. Zandile, let's start off there because me and Rhoda and I try to sort of unpack what is the meaning of occupational health and safety, because it does sound like quite a mouthful and a big word. But if you have to break it down and define it for us, what would be occupational health and safety?
Basically, to be just frank and make it easy for everyone, it is maintenance of health and safety of, in our case, the students, our visitors, and the staff as well in the workplace. So the employer, which is Northlink, they must just ensure that all of our students, the staff, together with our guests and visitors, they are safe and they must feel safe in our premises. That's basically the health and safety. It's all about the safety of the employees, employer, and the visitors as well in the workplace.
Yeah. So basically, we weren't far off.
Nope, we weren't, Dougal. Definitely not.
Yeah.
Yeah.
1 point for me.
So you mentioned some about the importance of obviously our occupational health safety person, officer like yourself at Northlink. So just a little bit more, because now me as a parent wanting to send my kid there, one of the main roles for my child, what safety would you have for them in place basically?
Okay, in terms of the safety measures that we have, we have 7 campuses in Northlink College. In all 7 campuses, we have signs and notices from the gate. When you come in, those signs and notices, they actually show you where do you go, where to park. Let's start even outside, where to park, where do you go. When you get into our colleges, you will see that those symbolic signs, they guide you that this side is the reception. This is where we have our sick, we also have sick bays. This is where there's sick bays. In case of emergencies, this is where you go. Those kind of stuff that are referred now on the signs and notices that we have in our institution in all 7 campuses.
All right, so you have that across the whole spectrum of Northlink, like you say, all the campuses. But Zandile, why is it so important to have occupational health and safety in place in the workplace? Why is it so important?
It's important so that people can know that the legislation itself, it says that now people must be safe at work. It safeguards the well-being of the employees. And also the legislation goes on and protects the employer together with the employees as well. So what I mean by that, employees, they need to know what can harm them. What are the hazards of the institution? For instance, we have 3 of the engineering campuses. There's workshops. So students need to know what are the hazards, what are the risks that are attached to those hazards. And as the employer, we need to make sure that we control those risks in order for the students not to get hurt and the staff as well.
Yeah, and so just on that, because I think that is an excellent example, just putting it in terms of the engineering side of things. Oh, yeah. So now my mind is running. So I'm thinking there's fire extinguishers everywhere for all of that. We're talking safety hats, hard, the equipment, and there's notices in place everywhere telling people that this is the case of it. And these are the little, and I say little, these are the things that need to be in place in order for things to run effectively.
That is correct. That is correct. In all of our campuses, we have those fire extinguishers, and we have trained marshals that each and every section, for instance, the workshops, each and every workshop will have 1 or 2 trained marshal, and there's also trained first aiders, as we might know that in those instances, on those situations, there might be those small cuts and all those kind of things. Yeah. So we do have those things in place, and we have people that are trained to assist the students together with our visitors as well and the staff.
So I just want to know, Zandile, your role as the occupational health and safety officer, what's your day-to-day operations? What is your operations a day?
Rhoda, the first thing that I need to put it out there is that as the health and safety officer, my role is to translate the legislation and ensure that now the institution complies in terms of the legislation. So we have 7 campuses. That means we have OHS structures in all 7 campuses. So what I do, I guide, I work with the campuses to ensure that we comply in terms of there's fire compliance, there's electrical compliance. Now there's also COVID compliance as well. So I'm actually that one person that runs around like a headless chicken in all 7 campuses, making sure that things are done the way that are supposed to be done.
Yeah. Now, Zandile, you mentioned legislation that needs to be in place. So my assumption immediately would be for an institution like Northlink. So obviously that accreditation then is very important, because let's use an example like the fire department. They will come and inspect to see whether you're ticking all the boxes, and also the relevant authorities to different aspects of safety.
That is correct. We are currently working with City of Cape Town to ensure that all 7 campuses, they are fire compliant. So it is very important that everything that we do, we are guided by the legislation. So we need to comply in terms of the Occupational Health and Safety Act. So that is why we have those stakeholders that are assisting us in order for us to be compliant.
Yeah. Now, obviously, as a priority, of course, we're talking safety here. So not so the safety of the students, which is paramount, as well as the staff and the guests that might be frequenting or visit the one of the campuses. As you mentioned, I mean, that is absolutely paramount. And I want to delve in a little bit more. Can you give us some of these details that you have in place?
Okay. We, as I've mentioned, that now those signs and notices that I've mentioned, that is now in terms of OHS. However, now with this time we have also COVID-19 now, so we have now the CRT members that are trained, that are doing our screening in all 7 campuses. That is now there at the gate. From there, we also have the Higher Health app for us, the staff, together with the students, where you actually screen yourself before you come to the campuses. And then when you go to our campuses, we have the posters everywhere. There's COVID-19 posters. We have sanitizers that are placed in those strategic places. That is now the entrances, the cafeterias, all the classrooms, they have sanitizers as well. And we have big boards that says no mask, no entry. So we ensure that all the time we are actually keeping those things according to the COVID-19 regulations.
Excellent. And I wanted to, actually, I'm going to ask you that a little bit later, because a lot of, from what I'm hearing as well, also means that a lot of is an involvement, you know what I mean? And things evolve as situations happen. Of course, procedures need to be established for that, even if if the situation was never there. Because I would just imagine, even if somebody just wants an electrical cable across the floor, well, and it needs to be done properly, I would just imagine. Yeah. But I'm gonna ask you that, because I know you wanted to touch on something.
That's right. I was listening to you now, and for me, the first thing that popped up was obviously the COVID that popped into this whole occupation and health safety, which had been put on your lap. How did you guys, basically, obviously being slap bang, here's COVID, how did you deal with that as an occupational health and safety officer? How did you deal with that?
Rhoda, to be honest with you, that it is quite a lot of things, because I'm now, as much as I'm the OHS officer, I'm also the COVID-19 compliance officer. But it is now better because we have the steering committee here at Northlink. Now, those are the people that also now chip in terms of the evolving that we're talking about. Each and every time when the levels are going up and going down, then the committee will sit, and then we will make all those changes and make sure that now whatever that we did, looking back, and then make sure that we better whatever that we did before. So there's also a lot of team effort from the campuses as well. As much as I'm the only health and safety officer, but I can never take the credit for everything. I have good team from all across 7 campuses, together with the committee as well. That is COVID-19.
Wow.
And student support, of course.
Oh yeah. I can just imagine.
Yeah, I would imagine as well. So how would you then ensure that people comply with certain policies and procedures that is in place when it comes to safety, or to health and safety at Northlink? Do you ensure that people comply with that as well?
We have 16 tools in terms of the Act, that those are the campus managers. So the legislation says that now the 16 tools, for instance, I'm going to make an example. Something happens at Pero campus. So there is a campus manager who is the 16 tool. My role is to remind the campus manager that you are the responsible person, because you'll find out that the person who is not complying is someone who is senior to me. However, if I go to someone and remind him that you have the power to do this, I always say that in order to ensure discipline, Discipline, because now the legislation is not written by Northlink, is not written by me. So to ensure compliance, if people they do not comply, they must be disciplined.
Okay.
I would imagine. Now, the thing I mentioned to you earlier was I said a lot of procedures and policies that would be in place would obviously also, once a situation is there or an event arises, then my assumption is you would walk into the room and say, okay, cool, don't block a fire exit. This needs to be in the room. That needs to be, this is the maximum capacity of the room. A lot of these procedures, when a lot of things take place, this is also the role that is also constantly evolving in terms of what is taking place. So rules that are in place today, tomorrow there might be an extra 10 rules in place or procedures in place in order to help that one rule that is in place. Am I right?
That is correct. Things are changing all the time. We'll find out that, as we've mentioned, that now we just last month we were on level 3. Now we are on level 2. Now whatever now that was then now is now no longer now here. So we need to make sure that each and every time there are now those changes, we come together and sit, and we also go and communicate, especially with the structures that are active at the campuses. Those are the people that must always know everything that is happening. And we also have now the emergency preparedness. That is that one document that all the time people, they must know, especially as I've said again, the structures. If anything happens, this is what step 1 you do this, step 2 you do that. So those are the things that we normally do. Every time there's changes, we sit together and see what to do about that and change our actions as well.
Yeah. So I like the thing with the evolving thing, and I thought of that.
Well done, Dougal. Well done. So just a quick one. What is it that you would like to tell the staff and students, what's important aspects of your job for them to listen to, for staff and students to take note of? What must they take note of?
Rolda, safety is not someone else's problem. Safety is your responsibility.
Wow.
As much as the section in the OHS Act says that the employer must ensure that now the safety and the health of the employees, they are put first. However, you need to make sure that you put your safety and the other people that are around you first.
Yeah.
You must not think of only yourself. Think of everyone else that is around you, especially this time. We need to be very what can I say? We must think of each other. Do not take down your mask if you want to talk to someone while you know that you are very close to that person. Yeah. We are all afraid of this thing. We are paranoid. Everyone is like that as well. So we just need to ensure that we are doing what are we supposed to do. And that's it.
Yeah. Sandile, I absolutely love it when you say, it is each and everybody's responsibility, no matter where we go, when we go from our homes, wherever we are in a public space or wherever we are. And I must say, from everything we hear, you certainly tick a lot of boxes. You certainly tick a lot of boxes. Thank you very much, Sandile Nombande, for your time on the Link Show. Thank you so much for joining us and giving us such wonderful insights as well.
Thank you so much for having me.
Absolute pleasure. That is Sandile Nombande. So she is the Occupational Health and Safety Officer at Northlink. And it is super important because this is how we started off. You want to know that these things are in place, that policies and procedures are in place. People have done everything they've done. They've worked out various safety plans, and that your safety is paramount. And I want to stress this because sometimes we almost take that for granted, Rhoda.
That is so true. Sorry man, I'm just hearing some voices there on the background. Yeah, that's very vital because we need to have these procedures in place, because I can just imagine with this COVID, then you're on level 3, then you're on level 2, then exactly what you had actually said earlier as well, then everything changes. Now you can have 50 people in, now you can have 100 people in. And the safety of our kids are so important, because I like to know if my kid goes to Northlink that they actually got all these procedures in place, exactly knowing that they are okay when they get there.
Yeah, you know what, and it's a bigger thing as well, and not to make it longer, but you know, the first thing you do on a plane, and once before takeoff, they explain to you safety procedures.
Oh, yeah.
And this is it. And what Zandile also said, remember, this is your responsibility, but they've made it easy. There's signs, there's post up everywhere to help you, and so you can rest assured that these boxes have been ticked because, firstly, legislation demands it, and obviously, an establishment like Northlink needs to be vetted for that.
There we go.
So this is very, very, very important. So I think it is absolutely wonderful. So once again, thank you very much to Zandile for explaining all of that to us. But I told you this is all about health today. So what we're going to talk about next is clinics.
That is right. One of the other most important things that needs to be at an institution. And that's why I must say hats off to you, Northlink. You've ticked that box as well.
Yeah, no, they certainly have. And this is definitely a big tick as well. So if mom, dad, if you're watching this, any prospective student watching this, these are the kind of things you want to know and make this definitely your tertiary institution of choice. I tell you what, it is just lots and lots of positive information. So a mobile clinic, how does that sound? Now, luckily for us, professional nurse Rolda Salam is the person that enjoys that specific designation. And she joins us next on the Link Show. Sister Rolda, thank you so much for joining us. Good afternoon. Welcome to the Link Show. How's it going?
Hi, good afternoon. I'm well. And how are you guys doing?
No, good. And it's good to see you again.
It's good to see you
again. It's good to see you. You look healthy. She's been taking her vitamins, Rhoda. But thank you very much for joining us. And let's talk about why health should be a priority. There's so many things we want to talk about it. But first, creating accessible healthcare services, of course, for the students. This is fundamentally what it is about.
Yes, it is. And the reason why we have the mobile clinic is to create affordable and accessible medical services to the students.
Okay, perfect. And then I just wanted to find out, because now obviously mobile, I'm thinking automatic, I'm thinking moving. So it's basically something that's ongoing and like it's moving all the time. I just want some clarity maybe on what is the benefits and what is the mobile clinic.
So in general, a mobile clinic is there to offer a number of cost-effective cost savings benefits to the healthcare system. It allows you to take the service to the student or to the client. So you are promoting early patient care initiation, improving patients' ability to self-manage their conditions, especially the students. And with that, it prevents them from going to a doctor or avoids them of visiting an emergency room or a hospital admission. So it's improving basically the quality of life.
Okay.
So this is the essence of the services that you offer. Now, Sister Rolda, of course, now the question becomes, what are the services that you can enjoy from the clinic? Mobile clinic, but what is the services that you offer? What do you do?
The mobile clinic, basically what I do testing. So if I talk about testing, I'm talking about your HIV testing. Screening as your TB screening for STIs or STDs, which is your sexually transmitted diseases. I give first aid care at campuses if needed. I treat minor ailments. I assist with injury on duties. I administer family planning, which is one of the huge needs at the campuses at the moment. I do basically a full assessment, makes a provisional diagnosis, give medical advice when needed, and if needed, I do referrals and I do counseling.
Yeah. So on those services that you've mentioned, so we're talking basic primary healthcare and screening tests. That is, and of course there'll be a lot more other than the ones that you have just mentioned.
Yes, there is a lot more services that are also being offered by me specifically, but then also I also have limited resources sometimes. So
Yeah.
Which is
then I
restriction, yeah.
refer the student. if
Yes,
needed.
good. Yeah, I heard you say that that you refer. So if somebody needs to go to service, you go speak to Sister Olda. That's simple.
As simple as that.
That's simple. I like that.
Sister Ronaldo, just you know what? We heard earlier there's 7 campuses. And obviously the challenge is quite demanding on having to service these 7 campuses. How do you ensure that you service the vast majority of these campuses? How do you do this?
So 7 campuses, which I have a schedule, a rotational schedule, which we work out over a 2-week basis. So each day I'm at a different campus,
Wow.
Monday to Friday. And the schedules is on the campus's notice boards with the dates where I would be at the respective campuses. On the notice board, on the poster as well, is the services that I do offer. There is, however, also a WhatsApp number that the students can call me or WhatsApp me during a specific time of the day if they have any questions that they want to ask me. And then the counselors at the respective campuses and the SRC members, they also do promote my services just to make sure that the students are aware of these affordable health services to them, that is there for them, basically.
Now that you say that, because it's I suppose it's a fairly new service, you know. I don't think this was around, like, let's say 20, 30 years ago, and that's what I mean when I say that. But how have students responded to this? How have they been taking up these sort of services?
Yes, now they are actually accessing the service quite often. Remember, I'm only here now for today, actually, a year. at
Wow.
Northlink College.
Wow.
So at the
Congratulations.
students weren't actually aware. They would come to me and ask, why is nurse here? And are you here just today? So I had to explain to them, no, I'm the college nurse, I'm your nurse. So
Wow.
now they are very eager to make use of the service.
It looks like you've made some best friends there, Sister Olda.
So, Sister Ronaldo, you probably face this quite a bit. So, somebody comes to see you, these students come and see you, even not just students, maybe even staff members, or, because you're servicing, obviously, just not the students, you're serving staff as well. And they actually have an ailment or there's something wrong, and you advise them to go see a doctor. Advice, how would you give someone who's in denial, to actually see a doctor, or that feels that there's nothing wrong with them?
Well, what I would tell that person is that your health is your most important priority. If you don't look after your health, you're putting yourself actually at risk. And by consulting a health practitioner and knowing what is wrong with you will put your mind at ease. There is specialists out there that can assist you, and there is specialist treatment that is available to you as a person. And then there's one thing that one of the previous doctors that I used to work with used to tell his patients is that if you don't make time today for your overall general health and well-being, you will be forced to make time for your illness. So don't be selfish. Don't think of yourself. Think of your loved ones and your family members that also needs you. So make your health your most important priority in life.
Yeah.
Sure.
No, it is super important. And when you say that, of course, a person can assume that you then can refer a person. As you said, you make the referrals. But now we're also talking external healthcare services. So in terms of hospitals, or, at least push somebody in the right direction.
So, yes, I do refer students and sometimes staff. So what I've created now for myself for the year that I've been here, and obviously I came with some sort of resources. So I am linked to most of the clinics and the hospitals. So then I would refer the specific staff or student to that institution or person depending on the needs of specific person.
All right. Sister Olda, I want to just move the conversation on from where we are. Now, when we speak health, and especially with a clinic sister, I mean, you got to have broad shoulders, because you're not just dealing with physical health, but there's also mental health issues and things that shouldn't even exist. And when I refer to that, because we all know it is probably that is the big pandemic, and we're talking gender-based violence here as well. And as a sister, I want to ask you that as well. So, do you help students with that are dealing with issues like that as well?
Yes, quite a number of students. And actually, some of them don't even know that they are being abused. Remember, there's all types of abuse. If I'm not present at the campus, each campus have a counselor that can also assist the student. But what we do at the student support services, me and the counselors, we work closely together. And if the need arises, or if we are done with a certain session and we find out that the student needs additional assistance, say for instance, psychology assistance, or the student needs treatment, especially when it comes to PTSD, post-traumatic stress disorder, do refer the student or even the staff member for further management and treatment in that regard. Remember, mental health is something that people are very, not, I won't say afraid of, but there's a stigma when it comes to mental health.
Yeah.
So when a person is abused, that is the most prominent thing that is affected is your mental health. And when your mental health is affected, your physical well-being is also affected at the same time.
Yeah.
So yeah, I personally do refer the students. I have a very good link with the 3 psychiatric hospitals because I come from that background. So I have a good link with the psychiatric hospitals.
So, yeah.
Please go for it.
I just wanted to ask you, so what is the call of action that the college and those that's watching now, what is the call of action now at this point?
At this point, at all the campuses, there is posters up on the notice boards giving students and staff guidelines as to how they can report these type of abuse.
Okay.
And sorry, man.
That's fine.
No problem.
Yeah, and my advice to those that are watching is that report all types of abuse. There is help out there.
Yeah. No, Sister Alda, thank you for sharing that, because that is actually what I wanted to ask you. Now, I've got 2 questions here, okay? Now, I'm a student and I want to have some sort of primary healthcare service done, so I know you're going to be at my specific campus on, let's say, Wednesday, so there I am. I'm waiting for Sister Alda, and there we go, and it's happiness. Now, as a student, one very important thing, and I need to ask you this. What cost are we looking at? What cost is involved here in order to access your services?
The service is absolutely free.
My goodness, are you being serious?
Sorry?
You being serious now? So for students,
I'm serious. Yes, it's absolutely free.
So there's no cost involved to the students to come and see you.
Not at all.
Well, you see,
They just come to my clinic and knock on the door, and they just enter, and everything is free. Whatever happens in that clinic is totally free.
I absolutely love that.
Love
and I love getting free stuff because let me get another free thing here. I'm so sorry. That's, you opened the free thing in me now. Mental, when physical health important, mental health as well. But we are at that time of the year where people are gearing up for exams. The stress levels have creeped up now, It's like, ooh, and all of that. I'm sure you've got like a tip or two just for people not to panic. What do they got to do? Do you have any, good studying tips as such? Do you have any for us, Sister Alda? You started the whole free thing.
Yes, I do have. Actually, it should start by time management. So students need to prioritize when it comes to study. So you need to have a study guide or study program. When it comes to your health during exams time, please eat healthy. When I'm talking about eating healthy, is make sure that you have at least 3 meals a day. Stay hydrated. So when I'm talking about hydration, I'm specifically talking about drinking water. Please avoid all the fizzy drinks and the drinks that the student is drinking nowadays for energy, the Red Bull and the Skol. That is very unhealthy during exam times because remember, exam times is a very stressful experience. Just add on to your stress. Try to get enough sleep. The vitamins to boost your immune because you really don't want to get sick during exam time. Try to do some little exercises, some stretching, and remember, which is most important, is your posture while you are studying. That is very important. How you sit is very important during studying. I think then that's basically it. Yeah.
You said the word posture, and all of a sudden I did this. Am I sitting correctly now? I just got to make sure. But thank you very much, Sister Rolda Salam. Thank you very much for sharing those tips, because that is what you want. You want to hear that from the professionals. So drink the water, do a couple of stretches, you know what I mean? And obviously
healthy.
your time and healthy. That is so important. Sister Rolda Salam, thank you so much for coming on to the Link Show and sharing some insights and giving us absolutely wonderful tips. And we wish you all the best as you go from campus to campus on a different campus every day. Thank you for everything you're doing as well. So thank you for coming on to the Link Show.
Thank you.
Awesome. Sister Rolda Salam, I tell you what, I had to ask if the services are free, but this is phenomenal.
It is phenomenal.
It is.
I mean, what more do you want, So, I mean, she's available. She's there to be able to answer any questions. I mean, and especially with the violence, with the... what you call that again? The
gender-based violence.
Gender-based violence. This is the real. It has happening, and the fact that there's somebody you can go and talk to. I mean, wow.
Yeah, you know what? There's two things that she said. So the first thing, just to be clear, I mean, she looks into primary healthcare services and screening tests, those sort of things.
Oh, yeah.
So the blood pressure things, glucose screening, those sort of things. You know what I mean? And she said HIV testing as well. She looks at that, of course, family planning services. These are some of the things that she mentioned, and I'm now adding extra there. But you got to go see her. But the thing I like that she said is no cost to you.
No cost to you.
As a student.
Oh, yeah.
Tick, 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 tick. Can you say ticky, ticky, tick? You're watching the Link Show. Thank you very much for watching. And of course, we've got everything to do with health today, which brings us then to our next guest in the Link Show. And that is Tammy Prince. Has Tammy been on before?
No, Tammy hasn't been. That will be the first time for Tammy.
Tammy is the first time that she's on the Link Show. We'll ask again. And Tammy is the provincial coordinator of Higher Health, which we're going to find out exactly. But Tammy, good afternoon from Rhoda and myself and everybody watching. How's it going?
Good afternoon, everybody. It's going extremely well. I hope you guys are doing good.
No, we are.
We're good.
So Rhoda said, first time that you're on the Link Show with us, yeah?
Welcome.
Yeah, happiness. So now, let's talk. What exactly is your role at Northlink College?
Okay, so I work for an organization called Higher Health, and we are a national agency that implements health and wellness programs to all the TVET institutions, universities, as well as CETs. So we provide and educate and link students to services. Just like Rolda has mentioned earlier, we would bring and host health and wellness days, which is called the First Things First program. And this is how we assist students to make sure that they make their health a priority.
So you and Sister Rolda would work very closely together then?
That is correct.
Awesome.
Makes sense.
Awesome. So we got so many questions for you, and of course we are definitely going to be touching on the pandemic, because that is definitely the thing that is on everybody's lips.
Oh yeah.
But creating the awareness now, because which is what we're going to talk to you about, of the vaccination drive that is taking place through everything, through the Department of Higher Education and Training. So does it still stand that any student needs to be registered on the EVDS, the Electronic Vaccination Data System? So would that apply for students as it would do for general public?
That is correct. It will apply for students and staff that has not registered as yet. In some cases, they are accepting walk-in, so you don't necessarily have to register, but registration is definitely ease out the process of administration work.
Yeah, and the
Okay.
reason I'm asking you that is because that is now where a lot of your focus is.
Yeah, that's correct.
Yeah.
That's right. And I know, I mean, one of the students that I chatted to as well were very confused because, they weren't aware of the fact, obviously, they could actually just walk in. Everybody's thinking they still needed to make an appointment. So I think what's important now is obviously creating that awareness, and this is exactly what you're doing regarding the vaccines as well. So my question would be, firstly, I think for anybody out there is, why should you be vaccinated?
So I would encourage students and staff to get vaccinated. And the reason for that is to protect themselves and to protect everyone else around them. Right now, it's the safest way in terms of protecting ourselves against the COVID-19 virus. So that is why it's important for us to get vaccinated. However, it's still the decision of the student or the staff member.
Yeah. Now, let me ask you this, because it's kind of similar of what Rhoda's asked you. Give me a consequence. I can assume some, but I would like to hear from you. Give us a consequence of people that now stay unvaccinated.
Okay, so a consequence would be they would be at higher risk than someone that is vaccinated. And the reason for this being is that their body has not built immunity to fight the virus. So when, for example, I'm living with people that are not vaccinated and I'm vaccinated, they stand a higher risk than contracting and spreading the virus, where because I'm vaccinated, I might not go to the point of being hospitalized or adapt or get infected in terms of where it gets to the point where I need to be hospitalized.
So the question would be, I can still get infected after having the vaccine, or can you still get infected?
Yes, you can definitely get infected if you have the vaccine, even if you are fully vaccinated, meaning whether you received 2 jabs of the Pfizer vaccine, whether you received 1 jab of the J&J vaccine, you can still get contracted to the infection of COVID-19 virus. However, you have a mild chance of ending up being hospitalized as someone that's not been vaccinated.
Yeah.
Okay.
So there's a lot of questions we want to ask you around this, and we know that this is definitely a hot topic. So we will navigate. We will navigate gently. So I say.
problem.
But now let's start off here. Okay. So currently, nationally speaking, we're the cohort of, is it 18 and older?
18 to 34.
Yeah. So everybody above the age of 18, obviously, they can register. How do you do that? What is the first thing you do? Now, I mentioned the EVDS earlier, but what is the first thing I do?
So the first thing you do is you would either, register on the EDVS portal, which is a self-registration portal where you'll basically go onto the link that they send you. There's also contact details on different websites. I know with the colleges right now, we posted posters where students can access, even in terms of using a USD, which is absolutely free, and then you'll register yourself on there. So the basic questions that they will ask you is name, surname, they will ask you for your ID number, and also in order for you to get a response from them, you need to fall into the age category of between 18 and 35 or above.
Yeah.
Okay.
And then are you administering vaccines for students? Because now the next thing would be, how do I find a site? But once you've registered, it kind of tells you where a site is. But if I live next door to a site or there's just one down my road, are you doing it on campus as well?
So right now, we are in the process of trying to negotiate with the Department of Health to bring vaccinations onto the campus sites. It's looking very positive, especially for our institutions. At the current moment, I can tell you CPUT, UWC are one of the big vaccination sites within the area of the Tygerberg district, and they are also jumping on board to offer vaccinations for our students and staff.
Oh, lovely. That's good.
Nice.
So
Nice.
what should I do? Say I'm not vaccinated now, and what should I do for those around me until I'm fully vaccinated? Like obviously everybody around me. What should I do if I'm not vaccinated yet?
So whether you are vaccinated or unvaccinated, I think it's very important to make sure that you continue practicing the precautionary measures, such as wearing your mask at all times, sanitizing your hands, washing your hands, keeping your 2 meter social distance, also making sure if you have any symptom or if you are feeling ill, that you go to a doctor immediately. And the reason why I'm saying this is we've gone through the first wave, the second wave, we just gone over the third wave, and there is discussions about we might be entering the fourth wave.
Yeah.
So even though you might be vaccinated, you still stand the chance of being infected. So for both unvaccinated and vaccinated students and staff, I would encourage you to please continue practicing your safety precaution methods.
Yeah, I was going to ask you that because, and you've answered it as Rhoda said, like what should I be doing if if I haven't been? But also, if you have been vaccinated, don't be now Mr. Superman because you still got to exercise all that precautions as you mentioned.
That is correct. So, especially now that we are entering exams and we're going to go into our December holidays, even though a lot of us might be vaccinated, that doesn't mean that we need to just think, oh no, we're vaccinated. So now I don't need to wear a mask. I don't need to sanitize my hands. The pandemic is still here. COVID is real. We're facing it every single day. Doesn't mean now that there is a preventive method, which is taking the vaccine, doesn't mean that it cannot be transmitted from one person to another. And also keeping in mind that there are a lot of people that are not vaccinated. So to protect ourselves and the people around us, continue with practicing your safety measures.
Yeah, wash your hands, wear the mask, do those things. Yeah.
Then I just wanted to find out, so I've had the vaccine now, and there's a lot of talk going around at the moment regarding the side effects of the vaccine. So what is the common side effects that one would experience after being vaccinated?
So there are definitely side effects to the vaccine. It obviously depends from person to person, from student to student, and also from staff member to staff member. So the common things are fevers, headaches, chills, muscle pains, diarrhea. And I know that there's a lot of people, immediately once they gotten vaccinated, they would complain about the pain that they feel after the injection. And that
which is with every injection.
Side effect, but it's fairly moderate to like short lastings. It does not something that will last for 3 or 4 5 weeks. It's something that will just last for that period after you gotten vaccinated.
Yeah.
No, it is the case. Yeah, like with any injection, you have that thing, oh, somebody got me. It's exactly that. I got to be honest, because you mentioned a bunch of side effects there. No, I'm still waiting for side effects to kick in. That's basically where I am. Now, let me ask you this, because actually, Rhoda's gonna. I've got another question. Yeah. You do one more.
Okay, I'll do
my
the
side
one
effect
more.
kicked in.
His side effect kicked in. So obviously there's a difference between having a flu and then having a cold. So if I've had a flu or cold, is there a time period I should wait, basically before I get vaccinated? Is there a time period?
Ooh, good question.
Very good one.
That's a very good question. So, yes, there is a time that you need to wait.
Oh, okay.
If you show any symptoms of a cold or a flu, I would advise and encourage you to go and see your doctor. And the reason for that is because we still don't know whether it could be COVID or whether it could just be a normal cold or a flu. So the first thing you will do is to go and to a doctor. If your doctor then might refer you to go and get tested, you get tested. And once you get your result, you are more at ease to understand, is this COVID or is it just a normal flu or cold? So, yes, you can get, the answer is yes. After you have, say for example, you had a cold or flu, you tested positive positive for COVID-19. Now you are in the recovery stage. From your recovery stage, you have to wait 30 days before you can get a vaccine. So when I'm talking about 30 days, I'm not talking about 30 days including the time that you're recovering, 30 days after you're recovering.
Yeah. Okay.
Wow.
So you gotta wait a little bit. Tammy, I
That's
wanna ask, but obviously, with that being said, I mean, your healthcare professional will advise you on that as well.
That's so, yes.
Yeah, so you got to have the discussion, as you said. I want to ask you this, and it's a bit of a left field, naughty question, if I can call it that.
That's why I left it for last.
Yeah, and I got to be honest, it's not a good question. Like, I don't ask good questions. Me, who knows? Yeah. But let me ask you this. So there's a lot of conspiracy theories. There's a lot of, funny information and all of that. And whatever people's reasons are, be that as it may. But where can people access reliable information? Because that seems to be one of the biggest hurdles, I would say. Where can people go? And especially students, where can they go? Can they come and speak to you? Is there a website? Reliable information.
Okay, so reliable information or website is definitely first our government website. They have a full page on myths, facts, exactly the most frequent questions about vaccinations, where you can get vaccinated, and also our government, our Western Cape government website. I can tell you they have been very phenomenal in terms of educating everyone in our province regarding COVID-19 as well as the vaccinations. You can also go onto the college website as well as the Higher Health website.
Wow, absolutely
brilliant.
Awesome.
Sure.
See, I asked a good question. It wasn't as bad as I said it would be.
Very good one.
Tammy Prince, thank you so much for your time on the Link Show. It has been absolutely wonderful talking to you.
problem.
And we wish you all the best. Thank you very much.
Thank you.
Thank you.
That is Tammy Prince, Provincial Coordinator, Higher Health.
Oh, yeah.
And there you have it. And she's painted a good picture and given us wonderful information. And students can go check it out. And mom and dad can go check it out as well.
Definitely.
Yeah. Rhoda, sadly, that basically gives us the end. Those are the three guests we were going to talk to.
That's right.
So
All about
first,
health, safety, and procedures.
And you know what? Just to encapsulate everything we spoke about. So first, it was just absolutely brilliant when we spoke to Zandile, which is the occupational health and safety officer. They're telling us about all the things that is in place. And I know I keep harping on it, but it is such an important thing that all of us as public need to understand. This is also something that involves, as you brought it up, the pandemic wasn't there. So those measures to keep people safe. Was brought in within a situation. And that is what they do. So as a parent, as a prospective student, you've got to understand that those boxes are all ticked. All ticked. Then, and I got to be honest, I love this because services, clinic services, the screening test at no cost. I'm going to stress that again.
That one.
Yeah.
Free, no cost.
Available. And doesn't matter at what campus you are.
7 campuses.
Clinic will be there, baby.
That's
It is
right.
as easy as that. It's as easy as that.
campuses.
And then, of course, we just spoke to Tammy Prince as well. After we spoke to Sister Rolda Salam, we just spoke to Tammy Prince as well, who kind of gave us that whole sort of a setup in terms of what they're doing and also for vaccinations and everything around that. So thank you very much to all three guests. But that basically means we are questioned out, Rhoda.
Questioned out, Dougal. But it was a fabulous show.
It certainly was, and it was absolutely awesome talking to our three guests this afternoon here on the Link Show, who really gave us a picture of all the health boxes that are definitely ticked at Northlink. And ultimately, this contributes and, of course, constitutes the fact why you choose Northlink as your institution of higher learning. Not only are the courses fantastic, but we're putting to bed all sorts of worries that you might have had.
As a parent, that is so right, Dougal. And don't forget, this is one of 3 shows that's coming up. So
that's
keep
right.
your eyes open and
28th of October.
On us. That's right.
Yeah, 28th of October is going to be the next episode. That is the important one. So and let me just double check that because I say 28th. I wrote it down. 28th of October, yes. And then, of course, we got the 25th of November as well.
November as well. That's right.
For the Link Show. Thank you very much if you've watched this. Once again, thank you very much to all the guests for joining us. The most important thing is you've got to like it.
Like and share. Don't forget.
From Rhoda and I, until next time, as well as Tammy Thomas, thank you for joining. Bye-bye.
Bye.